Good morning, good afternoon, good evening, wherever you are. I'd really like to thank UCI and all its components for putting on such a great educational event year after year. This is the place to go. These are my disclosures. Let's not make the same mistake we made in 1983. 46 years ago, we did not wrestle control of what is today a multi-billion-dollar industry peddling ICI across the globe. The worst part about the history surrounding ICI therapy is we andrologists have spent a significant part of our careers cleaning up the messes of providers and corporate entities profiteering in these clinics. But there are a few numbers on this slide that may pique your interest. Male aesthetics is a $4 billion market, and this is a 25% increase over the last 5 years, with male enhancement procedures helping lead the way. But who should lead it? Who should lead the way? The SMSNA and JSM were kind enough to allow me to scream from the rafters the answer to that question. Although we andrologists were not trained in the art of vanity projects, we are damn good at treating pathology. Our skill set, our fund of knowledge, and ability to crank out evidence-based techniques has urologists, especially those with andrology experience, perfectly suited to grab the yoke and take off with male genital cosmetics. Despite these pictures, it's not too late to do this. This is what happens when imposters take the helm. For example, over 25 years, urologists have known that silicone can cause a hypersensitivity reaction, which can rear its ugly head anywhere from 1 to 15 years after injection. As another example, one does not need to be a urologist to know that PMMA, or polymethyl methacrylate, also known as what? Bone cement, will not have the same compressibility as penile tissue. And let's remember this compressibility down the road in this talk. Let's see what other chaos these practitioners might create. For the first bad idea, remember bad idea genes from Saturday Night Live? How about using a cannula? Every time I watch this, I think of how we learn to work along the axis of the penis for IPPs so we don't get into trouble. As we watch these quote unquote instructional videos crafted by cosmetic surgeons or dermatologists, one understands why injection emboli are so common for these providers. Ouch. So, what are the manifold reasons beyond an embolism for not using a cannula? Bottom line, like sailing, where they say that for every 60 nautical miles traveled, being 1 degree off course at the wheel results in 1 nautical mile off track downstream. We have learned with reservoir placement for IPP that long lever arms in surgery lead to inaccurate placement and potentially high complications, just like cannulas in this situation. Let us look at some of the other bad ideas dreamt up mostly by cosmetic surgeons and not urologists. For example, free fat transfer surgery. First, let us hope they don't kill them with an embolus. Second, query those performing free fat transfer surgery regarding long-term rates for granuloma formation. Some of these papers suggest the rates might be as high as 25%, but frankly, no one truly knows because of what? Poor follow-up. Dermal fat grafts and acellular dermal matrix, despite the risk of contracture and permanent disfigurement, this is still carried on today in some of these aesthetic centers. So, HA, hyaluronic acid. South Koreans led the way with this material for penile girth enhancement in the early 2000s. This material resides in our skin to strengthen the protective barrier, so it's not alien to us. The G prime of HA, which is a measure of compressibility that I alluded to before, is very similar to our dermal layers in our penis. And finally, you will believe that HA fosters tissue ingrowth when you perform a circumcision on patients who have had HA injected. The South Koreans introduced us to HA, but all those papers from the early 2000s begged for a standardized technique. The novel technique we published in 2014 truly revolves around the process of using hydrodissection in a staged fashion for the most reproducible, functional, and cosmetic outcome. How reproducible? Very reproducible when utilizing stringent attention to following the aforementioned technique. One must always remind the patient the technique is staged, allowing the patient to have complete control over his final outcome. At this point in this brief introduction to fillers, for those urologists who still have a hard time with vanity projects, one might venture on building a neourethra for patients following IPP. This will address the age-old complaint of the pancaked penis. I hate to say it, but there were literally no adverse events in this group of neourethra patients. There was a 91% retention rate at 1 year, and we demonstrated patient satisfaction scores rivaling my IPP practice scores. One must remember that this is a near zero risk in-office procedure, not a high-risk implant. I certainly hope that you're all looking forward to our work on Peyronie's disease, where we're filling in any remaining hourglass or notch defects that we all work so hard to resolve with aggressive surgical treatments. So let's look back at our main topic, safe penile girth enhancement. In this multi-institutional and international study, we involved 574 total men. Mean age, 39. Range, somewhere between 21 and 82 years of age. This is over 7,600 injections of hyaluronic acid during this time. The mean volume where guys got happy, 18.6 milliliters of HA. The mean number of total injections visits was 5.45. There were only 12 adverse events, and these were local skin infections, and all due to patient noncompliance related to either time to returning to sex or aggressive shaving. To conclude, colleagues, this realm is legit when captained by urologists. What we're trying to teach the public is, quote, a urologist's hand defines safety, science, and standards. Far too politically correct for me, but it actually may work. To learn more about Urofil, scan the UR code or contact us through any of these aforementioned websites. I'd like to thank Dr. Suarez Sarmiento for getting this together for us so tightly, and of course Faisal and his group for an outstanding meeting. May it continue for a long time beyond my retirement. Bye.